Welcome to In the Know Medical Imaging, where we make medical imaging easy to understand. Breast MRI is one of the most sensitive diagnostic tools available for detecting breast tissue abnormalities and evaluating high-risk patients. But why do you lie face down during the exam? And how do contrast wash-in speeds tell us what a lesion is? Today, we are exploring dedicated breast MRI. We will explain what to expect as a patient while breaking down dynamic kinetic curves, high-field dedicated coils, and MR-guided biopsy protocols for our technologist community. For patients, one of the first things you will notice is your position on the scanner table. Unlike a mammogram, which requires firm tissue compression, a breast MRI is performed while lying face down on a padded table. Your tissue rests naturally into specialized openings in a dedicated breast coil. Lying prone allows gravity to extend the tissue away from the chest wall, eliminating painful compression while ensuring complete visualization of deep tissue structures. Breast MRI exams rely on a contrast agent called gadolinium, administered through a small IV in your arm. The technologist first takes baseline pictures before contrast is injected. Once contrast flows into your bloodstream, the scanner takes rapid back-to-back pictures for about 15 to 20 minutes. All you need to do is lie still and breathe steadily. Your technologist handles all scan timing from the control room. For our technologist community, acquiring sub-millimeter breast images requires dedicated phased array surface coils. General body coils cannot deliver the high localized signal-to-noise ratio needed to resolve subtle architectural distortions or sub-centimeter masses. Dedicated multi-channel breast coils utilize anatomical elements configured for bilateral coverage, accommodating parallel imaging acceleration while providing lateral access windows for interventional biopsy access. Diagnostic evaluation in breast MRI depends heavily on dynamic contrast-enhanced kinetics. Tumors induce leaky neovascularization, causing rapid contrast uptake and early clearance. We plot signal intensity over time to analyze three distinct kinetic curves. In type 1 persistent, signal increases continuously over time, typically associated with benign tissue. In type 2 plateau, signal peaks quickly and levels off, considered suspicious. In type 3 washout, signal rapidly peaks in early post-contrast phases and drops sharply, demonstrating high suspicion for malignancy. Optimizing breast MRI protocols requires managing the fundamental trade-off between spatial and temporal resolution. To capture early peak enhancement, early dynamic phases must acquire sub-minute temporal frames. However, evaluating lesion speculation and internal margins requires isotropic spatial resolution under 1 mm². Technologists deploy 3D fat-suppressed T1 gradient echo sequences combined with parallel imaging or view-sharing acceleration to achieve both high spatial and high temporal precision. Because breast tissue consists largely of adipose tissue which shines brightly on T1-weighted images, effective fat suppression is critical. Without uniform fat suppression, hyperenhancing lesions blend into surrounding fat, creating false negative results. Technologists use spectral attenuated inversion recovery or frequency-selective fat saturation, requiring meticulous magnetic fields shimming across the chest wall to ensure homogeneous suppression. When a suspicious lesion is seen only on MRI, an MR-guided vacuum-assisted biopsy is performed. The technologist immobilizes the breast using a compression grid, acquires a post-contrast localization sequence, and calculates precise X, Y, and Z spatial coordinates. Using specialized non-magnetic titanium or ceramic needles, the radiologist accesses the target, retrieves tissue samples, and places a radiopaque clip to mark the site. Breast MRI delivers unmatched clinical sensitivity, making it the premier screening tool for high-risk patients such as BRCA gene mutation carriers. In preoperative staging, breast MRI accurately measures tumor extent, identifies multifocal or contralateral disease hidden on mammography, and evaluates chest wall involvement, giving surgical teams the data needed to plan effective procedures. Dedicated breast MRI combines advanced coil engineering and dynamic vascular physics to deliver exceptional diagnostic clarity when patients need it most. Thanks for watching. If you learned something today, make sure to like, comment, and subscribe, and check out our merch store for more cool medical imaging items.